It's difficult to imagine that the poorest country in the Western Hemisphere is only a 3-hour flight from Toronto. It's difficult to imagine that on the same island, people are vacationing in the Dominican Republic, where a booming tourist industry exists. Haiti has virtually no successful industry. Haiti's modern history began triumphantly when slaves fought the French and Haiti declared a republic in 1804. Through the years, however, Haiti has endured continuous unrest, including civil war, occupation by the U.S., massacre by Dominicans, corrupt dictators like Papa Doc Duvalier, responsible for thousands of Haitian killings and exiles, and his son, Baby Doc, who would prove to be even more ruthless. Most recently, the earthquake that devastated Haiti has impressed upon the world through visual coverage the immense despair that these people live with every day. Many had no idea that this country deals with extreme poverty and malnutrition and widespread tuberculosis and HIV. It is so apparent that this is the opportunity for the world to reach out and help Haiti.
Canadian Friends of HAS supports the mission put forth by founders Dr. Larry Mellon and Gwen Mellon of Pittsburgh, which was to provide health care facilities fitting the needs of the impoverished Haitian population in the Artibonite Valley in Haiti. The main focus of Canadian Friends of HAS is to address the needs of maternal and child health care at the hospital and in the community. The main health concerns facing not only the children and expected mothers, but all Haitians are HIV, malaria, TB, and malnutrition. Dispensaries affiliated with HAS are situated in the mountains. They provide immunizations, HIV testing, traditional birth attendance, and other preventative strategies. Hopital Albert Schweitzer is only 2 hours away from Port-au-Prince, where the earthquake destroyed so many lives that were already in a precarious state. Due to the collapse or abandonment of several hospitals after the earthquake and the overwhelming stress then placed on the healthcare system, truckloads of people have been seeking help from HAS. Many are forced to wait outside in the open air until they can be seen by the medical staff.
Under normal circumstances, HAS helps those that reside in the area, approximately 285,000 people. Since the earthquake struck, the hospital has been given added responsibility of helping countless people from outside their area, on top of their usual patient load. This has not been easy for a facility that has only 190 beds. Many sleep on the floor, and patients who arrive get weighed, their blood pressure taken outside because of lack of space. Despite these challenges, HAS has helped thousands through the years. The staff at HAS certainly was overwhelmed with the influx of injured people during the earthquake. However, 54 years of experience and expertise allowed them to rise to the occasion and provide quality health care in difficult circumstances. Hamiltonians have taken a personal interest in HAS. Many people from so-called Steeltown have been involved in collecting school, medical supplies, and assembling birthing kits.
This fourth world country, meaning that it is considered a least developed country according to the United Nations, is the only one of its variety in the Americas. An estimated 80% of Haitians live in poverty. To illustrate the level of poverty, imagine how much the average Canadian makes in a day or two, about $250. This is what the average Haitian makes in a year. It is important for Haitians to be able to improve their lives and become self-sufficient. They need to be involved in making decisions about their future, Community participation will allow them to take ownership of the improvements and will get them fully immersed in the process of improving their situation. Canadian Friends has focused on maternal and child health care. Haiti has the highest rate of infant, under 5, and maternal mortality in the Western Hemisphere. The majority of these deaths are attributed to interrelated, treatable, and preventable diseases, such as respiratory infections, diarrhea, and malnutrition.
Hopital Albert Schweitzer has faced some major challenges throughout the years, a current one being a malnutrition ward that's overflowing because of the residual effects of the hurricanes of 2008. Children are fighting for survival every day, but a new method of combating malnutrition, one of the single leading causes of infant and child mortality, has surfaced at the hospital: Plumpy Nut. Plumpy Nut is recognized by the World Health Organization as a ready-to-use therapeutic food and could be the godsend that Haiti and other developing nations have been waiting for. This product consists of peanut paste, vegetable oil, and powdered milk, fortified with essential vitamins and minerals. It comes in a foil wrapper, requires no water, preparation, or refrigeration, and has a 2-year shelf life. It is easy to deploy in difficult conditions to treat severe acute malnutrition. So profound are its benefits that it is being compared to penicillin. It's inexpensive, fast-acting, and easy to use, very appropriate for fighting malnutrition in Haiti and other places such as Niger, Sudan, and Malawi.
Reforestation efforts have been ramped up in recent years because of the extreme importance of trees and their effect on the overall health of Haiti and its people. When times get tough in Haiti, trees bear the brunt. Branch by branch, on dusty hillsides, they're hacked down and turned into charcoal, the country's main source of fuel. It is estimated that Haitians chop down between 10 and 20 million trees a year. In 1950, about 25% of Haiti was covered with forest. In 1987, it was 10%. By 1994, it was down to 4%. Now, between 1 and 2% of Haiti's land is forested. In short, Haiti is a haunting, apocalyptic vision of ecological collapse. There is no point in condemning what has happened in the past. The focus needs to be on solving the problem in the present and future.
Birthing kits are a small, important collection of simple devices that facilitate a safe and healthy birth and decrease infection and tetanus for both the mother and baby. These kits are used by traditional birthing attendants in rural areas and mountains. A birthing kit includes a sharp blade, 2 pieces of string, gauze pads, a paper birthing mat, and disposable gloves. Since 1 in every 17 Haitian women die each year from complications due to childbirth, these kits have the potential to be lifesavers. Some donation dollars go to support the work in clinics in the mountains that act as dispensaries for thousands of Haitians that would otherwise have to walk at least 8 to 10 hours to the main hospital. Dispensaries are there to provide primary health care for many who inhabit the mountains. These include prenatal and postnatal care, immunization, and birth control education. The Haitians that live in the mountains are so appreciative of the opportunity to receive medical attention that does not require a whole day of travel.
Given the devastating recent earthquake and the heavier than ever patient load, the need for financial assistance at the hospital has never been greater. Contributions to earthquake relief and support for the Haiti happening have gone a long way towards addressing the need, but more funds will be needed throughout the year. If you have ever wanted to make a difference in a life, now is the time. Every dollar you donate helps inoculate and provide medical care for malnourished babies and children, helps provide education on how to avoid diseases like AIDS, helps deliver invaluable pre- and postnatal care, and helps the Haitian people in so many other ways. Caring people, through Canadian Friends of HAS, have raised over $400,000 for the hospital up to the end of 2009. If you have the means to make an additional donation to the hospital, you know that the staff at HAS and the Haitian people themselves truly appreciate every gift.